Everyone knows the phrase, with great power comes great responsibility. This lies in truth of pediatrics. With a great job comes great responsibility. Pediatrics is such a rewarding and noble and heartwarming profession, but it's much more than happy times with children and cute babies. When someone's life is on the line, the job becomes a very difficult and daunting task. But when you see how many lives you can touch in the process, it's only but a small price to pay when it comes to changing a child's life. And here's another video of how nurses change people's lives.
The NICU is an intensive care, which means that our babies are very critical, and we don't know if they're going to even make it through a shift. These parents, they don't get to take their babies home. I feel like if I treat the babies like I would want somebody to treat my baby when I'm not there, that's the most important thing. I do keep in touch with families once they've gone home. It's so rewarding to see how they're progressing. Babies that you thought would never even make it out of here. And just knowing you had a part of that is just a wonderful feeling. Okay. Press that arrow right there. There you go.
Renee was there the moment my son was born. The first time that he opened both of his eyes, she took the picture to capture it.
I was completely freaked out, and Renee calmed me down. She talked me through everything.
She was the first person to let me hold my brother. She asked, do you want to hold him? None of the other nurses are allowed. This is the first time that I got to hold him and caress him.
She loved my child as her own child.
Renee saved my son's life multiple times.
Renee, I want to thank you so much.
You are our hero.
There are not enough words to thank you for all you have done.
Thank you so much for everything that you did for us.
Okay. As you can see, so many young lives are touched in the field of pediatrics. Every child, every baby, every family has a story, and if I can be part of that story and make an impact in someone's life in any way, shape, or form as a pediatric nurse, then I will have fulfilled my goals in life. So with that said, here's my story. Hi, my name is Nicole OW. My topic of study this year is pediatric nursing with a focus of becoming a pediatric nurse practitioner. I'm a Filipino by blood and a homegrown Texan by heart. I like to draw, strum tunes on my ukulele in my free time, and although I'm not as good as I think I am, I'm 17 and I'm a dancing queen. I have a beautiful family of 4. My parents are both nurses, and I have 2 little sisters, my precious little sister Daphne, and my not so precious little sister Danielle. As far as school life goes, I've been a HOSA member for 3 years now. I'm actually the historian this year. And I am also involved in NHS, Student Council, and their committees. And I'm also in health science at the CT Center, and that's where I go on nursing home, fire station, and hospital rotations just to get a feel of the medical field. And outside of school, I also serve the community by serving through my church, Hope Fellowship, and I volunteer at Frisco City events, as well as Frisco Safety Town and Miracle League. So one thing that we do here in ISM is just read on anything that pertains to our topic and that we have a big interest on. So I started off my research in a fairly broad aspect. In my first 2 research assessments, I read articles about what nurse practitioners do in the whole spectrum of the healthcare field. I learned that they have a more autonomous role and they can work independently and even open up their own private practice. And I really like that aspect of it, having the best of both worlds as doctors and nurses and physicians alike. I also looked into neonatal nurse practitioners, and I later found out from one of my interviews that it's such a difficult subspecialty to be in pediatrics. There's a lot that goes on in that NICU, that intensive care unit, that you can't overlook a little thing, and you have to always be on top of things because a little baby's life is in your hands. In my third research assessment, I looked into private practice because I didn't know much about that environment. I was just used to hospital settings. So it gave me the business side of the medical field, and it also gave me like tips on like how to start it up, how to keep it running, how to keep it efficient, and just it also gave me like an idea of what I want to do like long term in my career. In my fourth assessment, I looked into pediatric trauma just because I really liked working in the ER in my health science rotations at the Medical Center of Plano, and I just wanted to read up on that, and I just learned that there's a lot of things that go on in there. It depends on what you get on that day, and it's a really good learning experience. And in my fifth research assessment, I read an article that current or previously graduated nurse students gave advice about how to make the most of your clinical experience while you're becoming a nurse. And it really helped me because it's just the little things like always being prepared, always being ahead, being helpful, and working as a team. Those little things can make like huge strides in your career. And in my sixth research assessment, I looked into evidence-based practice. And in definition, an evidence-based practice is a process in which clinical expertise, experience, and renovating medical research is combined and considered to apply to a certain practice and produce better quality patient outcome to update practice. This article talked about the importance of breaking outdated traditions of the standards of healthcare and looking for better ways to improve. And I really liked that because it gave me an idea for my final product as well. So I learned so much from reading the articles, but as fun as that was, I really enjoyed interviewing people as well. In ISM, we also get to get firsthand knowledge about our field of interest by interviewing people who work in that profession. People who work in pediatrics are probably some of the nicest, most genuine people you will ever encounter in the healthcare field. And I had the privilege of getting to meet 6 very delightful, passionate, and inspiring people who talked to me about their careers. So my first interview was with Ms. Christina Stiliano. She's an ER nurse at Children's Medical Center of Dallas, and she was actually an ISM student when she was in high school. So having been an ISM student herself, she knew exactly what I was going through and gave me advice on my future endeavors in ISM. We also discussed college just because I was in that process of applying and I had many questions considering nursing school, grad school, all of that. And she laid out a clear roadmap for me, which was really helpful. And I was very impressed by her having so much experience at a fairly young age. She's the prime example of how ISM is so beneficial and it can take you to the greatest places. The next day I conducted my interview with Miss Maria Crane. She's a pediatric nurse practitioner and she specializes in allergy and immunology at Children's Medical Center of Plano. The biggest takeaway I got from this interview was that there's no set path to becoming a nurse or a doctor or anything in the medical field. You just take your experiences as they come and learn to adapt to them and take it wholeheartedly. My third interview was with Dr. Capote Piga. She's a pediatrician and she's actually my pediatrician. But she's more than just a familiar face. She's a longtime family friend and she's been treating me ever since I was a tot. So I've seen firsthand how devoted and hardworking she is at her job, and I've always had a great respect for her because she works so hard in treating me, my family, and all of my friends. And she has such an expansive experience working with kids. She's worked in the Philippines, she's worked in Louisiana, she's worked in Philadelphia and here in Texas. So I got a lot of insight from her just because she's been everywhere and seen anything. My next interview was with my next interview was with Miss Sonia Estep. She's a pediatric nurse practitioner and she also has a lot of long-time experience. She's been in Texas and I got to ask her about TWU and UTA and all the colleges that offers really good nursing programs, and she gave me a good insight on that and what to do. My last interview was was with Mr. Rob Higginbotham. He's a good friend of Coach Goff's, and it was a really refreshing and fun talk. Like, we didn't talk about what I would usually talk about. We talked about like his roller coaster of an experience in the healthcare field, how he ended up there, and more of like the business side too, how to negotiate, how to deal with things once you get your job. And he was really fun to talk to. It was really relaxing and refreshing. This is my mentor. Her name is Lori Thornton, and she's an orthopedic nurse practitioner at Children's Medical Center of Dallas. When I met her, we talked about how her experiences as a family nurse practitioner and a pediatric nurse practitioner has differed, and how she has gotten here today, and just gave me advice about like how to take your experiences when you're in the field. And we also talked about more of the heartbreaking topics that come with pediatrics, like abuse, negligence, or any kind of disruption in the family. So that really opened my perspective on how treating kids is more than just putting a Band-Aid on the wound. You have to consider them holistically. So in ISM, we conduct like a bunch of events in order to go outside of our field of interest, just develop interpersonal experience and talking skills. So the first ISM event that we had was the business symposium, and I really enjoyed it because I would have never found myself talking to doctors, sales reps, authors, just in like one morning, and then end up talking to like an FBI agent later that evening. And I had an interview with Mrs. Dana Bird Hanks. She was very insightful. She is actually a social media rep or something. I think that's what she does. And she gave me like advice about interviewing and like interpersonal skills, and I found that really helpful, especially because I was interviewing her and then she started interviewing me for stuff. And then our next ISM event was our UNT educational field trip. We just went to classes that we would think we would take in the future in college when we pursue our career. And I went and sat in on a majors biology, a neuroscience, and personality psychology class. And I found it really interesting because it really put me in a different setting. I'm not really used to the whole college thing, and I liked getting a taste of that. And this was the research showcase that we had recently. We just displayed all of our research that we had conducted that semester, and yeah, here's some pictures. That's me and my board. There's my best friend, Michelle. Max. Okay, and moving on from that, I wanted to work on my original work, and I had to change it a couple of times just because due to like schedule issues, but I finally landed on my goal for my original work was to research and summarize 3 of the most common childhood illnesses that every parent should know into informational brochures. I wanted to assess like the most popular ones just so I can get a general knowledge about what I'm going to be seeing once I start shadowing, and I think the brochures really taught me that. And also the brochures would help the community because just because like some of these are common, they can get like misinterpreted just because they're so popular, and I really wanted to get a basic knowledge out there for parents and patients alike. So the conditions that I studied was infantile colic for the babies and the younger children, the difference between the cold and the flu for the younger kids and the teens, and then I studied adolescent depression for post-adolescents and teenagers. And the whole research behind this, I just got 3 articles each, and I made like a mini assessment for each of them, and then I started making the brochure. So the first one that I made was about infantile colic, and colic is a condition marked by predictable periods of excessive crying in an otherwise well-fed, healthy baby. I read about how it's actually a very common thing for babies to have, and just because it is doesn't mean that it's like unhealthy for them. And so I read upon like the rules that to, what do you call it, recognize what your baby has. So, and then also this is kind of a gray area illness just because they don't know the scientific causation for this. So it is very limited on the research there, but the diet is mostly related to that, so I researched into that and how that can be treated. And overall, it just doesn't affect the baby, it affects the whole family, because stress adds to the parents, and that can really hound on the family structure there. And this is the brochure that I made. This is the front. I said, dealing with colic, understanding your baby's crisis. And then in the back there, I wrote up a section about the myths, just because it's so like commonly misconceived as like a baby who has temper tantrums, but that's not the case. So I wanted to assess that there, stating, oh, it's not normal, or this versus that. And then I also talked about medication there. And then treatments, I gave a variety of treatments, both prescribed and things you can do at home. So this was like mainly for the parent, and I wanted to add that back there. And this is the inside of the brochure. I just basically defined colic as a whole, gave like a basic informational thing for the parent, like the causes, like the diagnosis, what to expect, and symptoms and signs. And then I also included the rule of 3, which is if they cry for more than 3 hours a day, more than 3 days a week, more than 3 weeks, that's like the signature of colic right there. So, and my next brochure that I made was over the differences between the cold and the flu. And I know it's kind of basic, but they're so misinterpreted within each other. So I wanted to really assess the differences between that. And so what I found out was they have a lot of similarities in their symptoms, like runny nose and sore throat and cough and sneezing. But their main differences is like just the onset of their illness, severity of the symptoms, the duration of the sickness, and like when it happens and when it doesn't. So this is the brochure for cold and the flu. Actually, let me go. Yeah, I laid the content here. I gave like a situational kind of intro. This is Tim. I said he has this and this. So what does he have, the cold or the flu? And as you can see, there's a lot of similarities within their symptoms, but the main differences between them are like the severity. The flu is actually can be detrimental to the child if not treated well. And the cold, that's just a smaller version of the flu. And I just wanted to assess that there. I also included the treatments, and yeah, and then on the back it said Tim has the flu. I gave him the flu just to make a point. And then also on the side here I just gave some basic information about the cold and the flu, just so they could have a common knowledge over that. And then my last brochure was over like post-adolescents and teens, that age range. And I did adolescent depression, which I really wanted to go over just because there's so many like diseases and illnesses that we say like in our common vernacular that we take out of context, like OCD, like, oh, I'm so obsessed with keeping my room clean, I have OCD, or ADHD, I can't focus in class, I must have ADHD. And like depression is definitely one of those. It fits in that category because depression is not just feeling sad or below the weather. It's way more than that. It embodies a lot of psychological, physical, and emotional stresses. And I really wanted to look over that, especially because suicide is one of the leading causes of death in our age range right now. So this is the inside. I just gave a general definition of adolescent depression and gave like the causes. And right in the middle, I really wanted to put the statistics, like the numbers that there are showing today in society, just so it can like have an impact, like, oh, this is actually a big thing. It's like overlooked. and some people don't know that. And then on the side here, I also included some signs and symptoms. This is for like the parents, just so you could recognize if your child or your teen has depression, because it's such a serious problem. There's a lot of physiological indicators and behavioral indicators and psychological indicators, and I just wanted to list that out. And on the back, I also included like a debunking the myth section, because there's so many like gray areas in depression. Like, I've been feeling blue lately, I must have depression. I wanted to say that was wrong, because it's more than just a mood. It's like a total embodiment of your health. And then this goes away on its own, time will heal me, and that's wrong too. Or I will never get better. That's the worst one that you can hear from a teen, because that basically means, oh, my life is nothing. So I really want to put that there for the parents, and also talk about the remedies and the therapy that they could do. And I also looked into like pharmacological treatment and I looked into SSRIs, which are serotonin suppressive indicators, I think, which really help with the chemical imbalances of the brain. So I learned something new there, and yeah. Okay, so moving on from that, the colleges that I'm looking at right now are UT, Baylor, TWU, NYU, and UT Dallas, just because they have really, really good health programs, especially TWU and UT. And I really like how the way they do things. And hopefully that happens. And I just want to lead off with a quote, my mantra for this year. It says, "Success is no accident. It is hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you are doing or learning to do." And I take this quote to heart, not only because it was said by one of the greatest soccer players in this world who ever lived, but just because I believe it encompasses everything that I want to accomplish and hope to accomplish in ISM and further on. My lifelong goal is to take this knowledge and just apply it to wherever I go. And yeah, ISM's really opened up many opportunities for me to like push myself, open up my comfort zone, and it has tested me a couple of times, but I've come out as a better student and person that way. So yeah, thank you for your time.